first time we're doing it, a fireside chat with our policy director, Nicole Braccio, and NPAF volunteer and Medicare volunteer, Tony Sowery, who will highlight everything you need to know about Medicare. And as many of you know, this webinar falls right in line with our Medicare Week of Action for the Get Covered campaign, and I'll talk a little bit about that in just a bit. But before I turn it over to our Medicare experts, I just want to quickly go over some housekeeping items. This call is being recorded and will be available for sharing in the future. Once, I think maybe around next week, we'll have a link available so that you all can share this resource with other people you know who maybe could benefit from hearing some of the information we're going to talk about today. We ask that you please mute your lines, and we have just some images there to show you how you can navigate to do, or how you can get to that in the Zoom menu bar. But of course, if this is an interactive conversation, so if you have questions, we ask that you just please raise your hand and unmute yourselves to ask those questions when the time comes. The other thing I had noted at the beginning of this call, if you haven't already, please introduce yourself into the chat. Please let us know where you're calling in from and maybe something you want to learn from today's fireside chat with Nicole and Tony. We always want to make sure that we can, meet exactly some of your expectations here with doing these types of educational events. And so, as I said at the beginning, this webinar, this fireside chat, is focused on Medicare. Medicare's annual open enrollment period is currently underway. It started October 15th. The last day is in less than a week, on December 7th. And this week has been our week of action to really raise awareness about Medicare open enrollment. And we understand that, you guys may be wondering, like, why are we doing it so late? Medicare open enrollment period ends next week, but we think this information is relevant year-round because people become eligible for Medicare 3 months before their 65th birthday. So even if you have already made changes to your Medicare plan, or you aren't eligible for Medicare yet, we hope you still can take something away. And if you're not Medicare eligible at all, you might be helping a loved one enroll. We hope this information that we share here today will be helpful to you. So in addition to raising awareness about the Medicare open enrollment period, we also, as part of the Get Covered campaign, really want to direct people to resources that can help them with comparing plans or making decisions about what's best for their situation. We think open enrollment is a really important time to kind of hit that pause button and think about, the care that you're receiving and how your relationships are with your doctors, how the medications you're taking, how are they making you feel? We think it's we sometimes call it doing an annual healthcare audit. And we think open enrollment is a really great time to do that. And we've developed resources to really help people take a look at some of these things more closely and see how that can factor into some decisions they make in terms of, changing some things within their insurance plans to maybe save more money or maybe get on medications that might make them feel better and again, save more money, because I think we know a big part of, what's top of mind for a lot of people is out-of-pocket costs and how we can really protect people's finances. And so for those of you who are new to NPAF, and I see a lot of new names here, and I'm really excited for that. This Get Covered campaign is sort of, if you think of it in the calendar year, it is the last of our campaigns to happen, but all of the campaigns that we do 4 in total, really build on each other. So we start the year off focused on care planning. Our caregivers count and health needs navigation campaign are all about directing people to the resources that are available that can help them better access healthcare or address any needs that they may be unmet needs that they may have. And then the GetCovered campaign really brings all of that together to make sure that, people need health coverage for all of those other things to make sense, right? And so that's sort of the arc of the patient experience. And we really invite you all to participate in our other campaigns or to sign up to volunteer if you haven't already, because we think what our volunteers do in bringing these campaigns into their community is just so meaningful. So with that, I am now going to turn it over to my colleague, Nicole Braccio, who's really who's going to kick off this fireside chat with our other expert here, Tony Sowery. So Nicole, please take it away.
Thanks, Melissa. And it's so great to be here with you all. And I'm excited to see over 35 people joining us to learn more about Medicare. So I saw a bunch of great topics that you all have raised in the chat already, and we will try our best to cover as much of that as possible. I did just want to start off with a little disclaimer that this webinar is intended to provide information only, and so questions that are about your specific situation are probably best answered by personalized navigators and counselors. So we will certainly let you know how you can find them, along with a list of resources. But just to note, if there's a question you have, if we can boil that down to something more general, we will absolutely try and answer that. But personal, specific, my situation type questions are best left for the one-on-one navigators. But with that, if you go on the next slide, I did want to just level set with a little bit of a framework for Medicare. As many of you, this might be, your first time looking into this for a friend or a family member, or you may be very familiar with Medicare and you may have it yourself and are looking, for more information about how to make choices and what choices are really available to you. But in general, Medicare is one of the largest public payers of healthcare in this country. So original Medicare is run through the federal government, and it becomes available to people when they turn 65 years old. So a few months before you turn 65, you should get a pretty thick packet in the mail, the Medicare NU handbook that starts to prep you for the decisions you'll have to make. Which would include deciding between this original Medicare or Medicare Advantage. Medicare Advantage is similar, but the way that it's structured is different because it is essentially a bundle of the different components of Medicare that is run by private insurance companies. So when you talk to your Medicare Advantage plan, you're talking to a private company like United Healthcare or Aetna. A lot of the big health plans have Medicare Advantage options. So that's sort of the main overarching difference. And we'll get into a lot more of the details, the pros and cons with Tony in a little bit. But in general, the components of both options really are, very similar if you look side to side on the chart. So you have your Part A, which covers hospital care and inpatient services, as well as things like hospice and a bunch of other things. Part B, on the other hand, is more of the physician services. So when you go to a doctor's office or you go to a specialist, the Part B component of coverage is what you're using. Now the prescription drugs are covered under this Part D for drugs. So with original Medicare, you have to sort of add on a Part D plan, whereas with Medicare Advantage, it's all sort of bundled. So the Part D, as in dog, coverage is included in one package, usually. And then finally, with original Medicare, you have the option of adding on a supplemental plan. So some people use like a retiree health plan that their job, former job offered as a supplement. Other people may choose to use what's called a Medigap plan. But this essentially helps pay, it's an additional part of coverage that you pay for. So you're paying like that monthly premium for it, but it helps to kind of offset some of the other out-of-pocket costs that you may incur with Part A, B, or D. And that's only in Original Medicare. Now, if you have a Medicare Advantage plan, you don't have the option to add on the supplemental Medigap, but most Medicare Advantage plans do offer additional extra benefits like vision, hearing, and dental. So this is where you start to see when we talk about shopping for a plan, largely we're talking about shopping for the different types of Part D plans that are available, or we're talking about Medicare Advantage plans, which vary significantly across the country. So what might be available to someone in Los Angeles, California, is going to be very different than someone who's looking in Rochester, New York. And yes, I believe we will be able to share the slides, so you can have this as a reference. And a lot of this information is also available in some of our other resources that are packaged in our plan guide, which we'll share in a little bit. So I think with that sort of overarching framework, we will dive right into our fireside chat. And I'm so happy to introduce our friend and volunteer, NPAF volunteer, Tony Sowery, who has been such a great asset to our team and really even helped us to build out the Medicare plan guide, as well as this new cost resource that we have built. So truly a partner, and it's such a pleasure to have you here, Tony. And with that, we will go ahead and start with our fireside chat.
Well, yeah, thanks very much, Nicole, for inviting me here today. It's great to be able to participate in this webinar. So just a little bit of background. How did I get involved in all of this? As I was coming up to retiring, I knew that I wanted to do something in the healthcare policy advocacy world. I grew up in a medical household. My father was a doctor and my mother administered a community family planning clinic. So forgive the pun, but healthcare was in my veins, I guess. I was then really pleased when I came across NPAF, who seemed to tick all the boxes for me. And I joined them as a volunteer in late 2018. At about this time, I was also going through the sign-up process for Medicare myself. And I was amazed how complicated and difficult it all seemed. I'd had company health insurance for 30 odd years or more, I forget. And I didn't have to make any of these decisions as far as I could remember. And I was just amazed how complicated and difficult Medicare was to grasp. However, in Medicare, I realized that this was in fact a great opportunity for me to add to my volunteering. And this time I would be able to do some sort of at the coalface volunteering with one-on-one help for people as they came up with issues about Medicare. So I signed up for one of the SHIP branches, the one in California, one of the ones in California. SHIP, by the way, stands for State Health Insurance Program. There's an assistance in there somewhere, but anyhow. And they have branches in all of the states over across America. And they do one-on-one counseling. After 6 months or so of training and studying, I gained my accreditation and I was let loose as a Medicare counselor. Since then, one of the truest things I can say about this is that every day I learn something new about Medicare. You know how folks, when they retire, they take up bridge or crosswords, or they get a new dog or a new partner, all to stay alert and nimble after retirement? Well, I do Medicare.
Well, we are really glad that you chose to spend your time this way because, and I think what you mentioned about learning something new every day, let's not overlook that, because Medicare, I mean, for everyone watching here, even for myself who I study this as my job, Medicare is extremely complicated. And it is, if you're feeling confused or overwhelmed, you are absolutely not alone, because, it was not, it wasn't made to be understandable, really. It's sort of, building layers built on top of each other over years to create this huge program, which has so many moving parts. So we hope with this, the questions we'll go through today, that we can sort of uncover some of the mystery around it. And I think just to get started with that, why don't we look at the enrollment periods, just review sort of what the enrollment periods look like, because there's, again, a couple of moving parts here. So first, we have the annual enrollment period, and we have a slide that just shows sort of the 2 times of the year that you should be looking out for if you are enrolled in Medicare or approaching enrolling in Medicare. So the annual election period, which kicks off every year, like Melissa said earlier, runs October 15 through December 7. And during this time, if you are enrolled in Medicare, you can make any changes you'd like. If this is your, if you have not yet turned 65, and there are other individuals with certain disabilities who are eligible for Medicare prior to turning 65. But if this is new for you for your first time, 3 months before your 65th birthday, you will receive that packet I mentioned, and you can begin to start, comparing plans. If you're thinking about Medicare Advantage, and really just making that choice of, do I want to go with original Medicare or Medicare Advantage? It's sort of the first step. And during this annual election period, for everyone who's enrolled in Medicare, you can make any changes you want. So you could switch between various plans, go from original to Medicare Advantage, go back from Medicare Advantage to original. And then there's a second enrollment period that happens a little bit later. Coverage, so by that December 7th date, if you make your enrollment selection, your coverage will start in the new year. For Medicare Advantage open enrollment, there's a separate period. So they kind of give you a second chance to make a change. So between January 1 and March 31st of every year, you can decide, maybe this isn't for me, I want to return to original Medicare, or you could switch between Medicare Advantage plans. So I think one of the questions we wanted to tackle today is, what are some important caveats that seniors should know about regarding these deadlines and the open enrollment periods?
Well, I think, Nicole, probably the most important one, which is actually both you and Melissa have already mentioned, is that all of these complicated enrollment periods, whilst they're very relevant, perhaps the most important point is when you first sign up for Medicare. And that is not restricted in these ways. You can do this when you turn 65, 3 months either side, as Melissa just mentioned. And I think a lot of people lose track of that. So that's something I would stress. There is something called special enrollment periods, which I won't go into, but they cover a multitude of different circumstances also, which are very important. So I think that's probably the key thing here.
Got it. So 3 months before, 3 months after your 65th birthday is, a key time to, be looking at all of this, for sure. And then what happens, we hear about penalties if you're late to signing up for Medicare. So can you tell us a little bit about the gravity of the situation here? Because I know it can be, sort of, people are blindsided by this.
Yeah, so thanks for letting me do this one, Nicole. Yeah, the dreaded penalties, they do exist. For example, if you delay signing up for Part B and do not have employee health insurance, you can face a 10% penalty and add on to the Part B premium for each year you delayed that signing up for Part B. There is a 1% penalty for each uncovered month if you delay your Part D enrollment. The rules of penalties and their application are very complicated. What I'd suggest we do is if we have time at the end of this webinar, I can talk a little bit more about some of these rules. And alternatively, if folks have a problem with that, we can give them the right information, where to find the information.
Yeah, absolutely. And I'm sure this is also something that's covered in the Medicare and You handbook. Is there a section on this?
Yes, there is. For everyone who doesn't know, oh, I'm not sure I can see this, but this is the handbook. It's not showing very well.
Yes, but it's pretty thick, right?
Yeah, it's 150 pages long. But it is actually a very good book, and I'll mention this again, but there's also another incredibly good source of information, which is Medicare.gov, their website. It is surprisingly good and helpful, and you can just type in a question and it will take you to the answers. And I really recommend people. It's nothing like as overwhelming as this book, because you can focus in on what you want to read about. And we'll talk about this Medicare.gov later on as well.
Great. Okay, so I think the big question that usually pops up first is, how do we make the choice between original Medicare versus Medicare Advantage? And I think there are certainly some pros and cons to each. Our NPAF's plan guide does have a pretty simple chart that outlines the key differences. But I know that this is something that you probably work with clients, Tony, all the time around. I know we can't, you can't like recommend, hey, I think this is. You can't sway people one way or another into a certain option, but you can lay out what are the pros and cons of each. So if we look at Medicare Advantage, again, it's a private insurance run by private insurance companies. So the structure is a little bit different than original Medicare. However, what are let's start with the pros. So, why would someone choose Medicare Advantage? What are some of the benefits to having this option?
Well, I think the first thing to say is that MA, let me use, if I might, the word MA rather than repeating Medicare Advantage 100 times in the next 20 minutes. So the MA plans, they include the basic hospital and medical coverage that original Medicare does. Most MA plans now also offer prescription drug coverage. Many of the MA plans offer extra benefits such as dental coverage, vision, hearing, and increasingly sort of things like gym membership and fitness programs. However, I think folks need to look very carefully at what's in these plans. In many cases, the benefits are quite basic and limited in scope, and all I can suggest is that you read carefully what you're actually getting and don't make too big a decision based on those goodies, if you like. One very important part of MA plans is that they cap the annual maximum out-of-pocket expense. That means that once you get to a certain amount of expenses under your plan, the rest of it will be paid by the plan. In my county, for example, in California, these caps range from a low of around $3,000 to, I think it's $8,500 a year. Related to this, some MA plans have very low monthly premiums, which is a big selling point for them, actually $0 in some cases. So you're not paying a monthly premium, but you are paying the out-of-pocket expenses. The caveat with these low monthly premium plans is that they usually come with a high maximum out-of-pocket. So you have to balance these two. You're going to get a low premium, but a high out-of-pocket. MA pricing, Medicare Advantage pricing right now is sort of a mixed story. The good news is that the average MA premium for 22 is going to be down by approximately 9%. However, the maximum out-of-pocket caps went up by 13% last year. So again, there is this trade-off, and it's not that simple to say that one thing is going down where the other is going up. There are pockets that are going up and pockets that are coming down. So that's a little bit about the advantages. On the other side, the flip side is that under most MA plans, you're going to be limited to the network of providers you can see, and you won't be covered if you go out of the plan network. You will most probably not be able to remain with your existing team of doctors and providers when you sign up for MA. Almost always you will need a referral if you want to go or need to go to see a specialist. Getting those referrals can take time and can be a source of frustration.
Actually, Tony, real quick, Melissa, can you go back to the chart slide? Because I think some of that might be helpful as Tony's talking through some of these. And just quickly to elaborate on one of the things you said earlier about the out-of-pocket costs, which can vary. Just want to point out again here that with the original Medicare, remember any doctor that accepts Medicare insurance would be covered, right, with a generally 20% co-insurance. So you would be responsible after the deductible for 20% of the cost of seeing a doctor if you have original Medicare. Where with Medicare Advantage, Tony mentioned about provider networks, you may not always be able to see the same doctor, which, that's again a trade-off, right? So when you're looking at Medicare Advantage plans, because these plans are run by private companies in sort of local areas, right? So they, in New York, there might be a network of doctors, in, let's say, within 50 miles of you, that accept this certain type of Medicare Advantage plan. And there could be, some areas have many Medicare Advantage options. Others may only have one or two. So it really depends where you are in the country, whether you're in, a rural area, an urban area where it's more densely populated and there are a lot of doctors nearby. So when it comes to Medicare Advantage, if you are in an area that where there happens to be a very robust provider network, then you might be able to keep your doctor. But that's the thing you would have to check. You can check kind of on both sides. You can ask the doctor, hey, doc, do you take this Medicare Advantage plan? I'm thinking of choosing this one. And they may or may not know. They should be able to tell you. But the other option is when you're looking at comparing the Medicare Advantage plans on Medicare's website, you can also see who's in the network of each plan. So there are two sort of ways to check that. But all of this, everything that you've touched on so far, Tony, all of these considerations do take time to evaluate. So that's why we always recommend giving yourself enough time to make those phone calls and ask these questions, because it can be time consuming. So go ahead with the rest of those.
Nicole, I would completely second that. I mean, if, for example, you're you're signing up for Medicare for the first time, I mean, this is not something you can expect to spend half an hour on. It is a process where you're going to have to get educated and research. And the more you put into it, frankly, the more you're going to benefit from doing that. Back to MA plans themselves, I think we've more or less covered it. I mean, what Nicole mentioned about some counties having many plans, there are many counties that have 20 or 30 plans. There is also a surprising number of counties, because MA plans, by the way, are sold by the county. And there are some counties that have no plans. Medicare Advantage is not an option. Not many. I was trying to find out about that this morning when I was doing a bit of research, and I think there is, if I remember, there are 19, I can't remember, but I think it's something like 19 counties in the states where there is actually no Medicare Advantage plan at all.
Right.
Nearly all of them, as Nicole said, rural.
Yeah, and Tony, the other thing you mentioned earlier about the premium costs, right? This is laid out in our cost worksheet. So refer to that. I'm going to put these resources in the chat right now so you guys can look along, because there's just so much information to share here. So apologies, we can't have, you know, each of these topics really warrant its own discussion, but here are the resources that we keep referring to, because it may help to just kind of look along with that. So I just put it in the chat. But regarding the premium costs, right? And with your Medicare choices, with original versus Medicare Advantage, there are kind of two sets of costs associated with them. Now, everyone, I'm sure you're maybe familiar, you know, having had insurance at some point in life, you know, when you have an insurance plan, you're paying a monthly premium for that plan. You're also usually responsible for a deductible, which could be a couple $100, could be a couple $1,000, but that's you paying for the full cost of your insurance, the full cost of your healthcare when you go to the doctor, until you reach that limit, that deductible, and then your insurance kicks in and starts paying, right? So you're sort of paying completely out of pocket in the beginning until you hit that number, the deductible. And then after that, that's when co-insurance or co-payments start kicking in. And so you are paying a percentage or a flat sort of co-payments related to anything that you're getting, right? Prescription drugs. And there are some exceptions for things like preventative care. You know, there are some exceptions where you might not have to pay a copay right off the bat. But generally, you know, when we talk about that 20% co-insurance in Part B, that's sort of what we're talking about, where, you know, the amounts that you're responsible for paying throughout the year kind of changes depending on where you are in your benefit, how much healthcare you've, you know, utilized, as they'll say, but really, like, how often are you going to the doctor, right? So when we talk about the premiums, the Part A and B premiums are like everyone's paying that no matter what. Part D, if you're in original Medicare, is a separate premium. And then with Medicare Advantage, generally it's the D, because the D is included, you're paying for, you know, your A, your B, and then your Medicare Advantage premium, which the benefit that Tony mentioned is sometimes that extra premium is zero. So like, that's an incentive to go with a Medicare Advantage plan, but then weigh that against, okay, who does this plan cover the doctors I want to see? Does this plan cover the medications I take? So there's a lot of calculus here, but we hope that some of these worksheets can at least break it down and help you, you know, make sense of that. And I'm just looking at the chat real quick, but go ahead, Tony.
Nicole, you mentioned under the topic, I guess, of original Medicare, that there is a 20% copay. And that can very, very quickly mount up to be some expensive, big expenses. That is one of the reasons why many people take out a Medigap or supplementary insurance plan, which basically, I mean, in crude terms, the concept is that your Medigap plan will pay for everything Medicare does not pay for. And that is one of, it's almost usually the case when people have original Medicare, they will consider, if not take out a Medigap policy. And I'm going to touch upon that in a minute, but I mean, not to flog this whole original versus Medicare Advantage, but I think the general perception is that Medicare Advantage is the lower cost option. But even that is not so simple because, for example, a 6-day hospital stay, not a 5-day, but a 6-day hospital stay, if you're unlucky enough to have to be in hospital for more than 5 days, actually the cost is greater under Medicare Advantage than it is original Medicare. So equally, as we've mentioned, I mean, one of the attractions of MA plans is that they have low monthly premiums, 0 in some cases. But herein lies the problem, determining which is better, original or Medicare Advantage, is really only possible as a matter of hindsight, because until you know what your bills are at the end of the year, you really don't know which was going to be the better financial option. And I think what one has to remember here is that you've got to think about the quality of care as well, and not just the dollars at the end of the year.
Great point. And I just wanted to touch on one question that just came in from Cynthia, because it's related, and then we'll move on to the next sort of the next topic. But when it comes to traveling, this is a good one, because generally if you have original Medicare, and again, national programs, so if you are traveling, if you live in Florida and you travel to New York, or probably vice versa at this time of year, you know, and you need to see a doctor, you probably will have an easier time finding a doctor in Florida, you know, that takes Medicare, that would be able to see you if something happened, if, you know, or urgent care, something like that. But if you have Medicare Advantage, because the providers you're able to see are, you know, have to be in the network, which are local, right? So if you're local to New York, you might have a hard time or not be able to find a doctor who can see you in Florida. So
Nicole, one thing I'd just like to jump in on that, if I might, is that interestingly, yeah, under Medicare Advantage, if you're traveling out of state, you're not covered. But I've come across quite a number of cases recently where people are having telemedicine calls with their doctor. You see, and it actually, I don't think you need to even tell your doctor where you are. So it's, and you know, I think in the last year or two, telemedicine has been growing enormously. So this may be becoming a slightly less of a roadblock in terms of Medicare Advantage. I don't think there are any, unusually for Medicare, no one's come up with a rule yet. Right. They probably will soon, but.
Yeah, I know CMS, it has, you know, during the public health emergency, sort of made the rules around telehealth more flexible in Medicare. But, you know, there may be other policies that can influence whether or not this is available. Yeah. So we'll have to stay tuned, but definitely telehealth has, you know, made being connected easier for some. And yes, Melissa, CMS, the Center for Medicare and Medicaid Services, the federal agency that governs these programs, and they are the ones who make the rules and what we're translating to you all. And then just really quickly, there was a question about supplemental plans versus MA. So just to make one last clarification, when we're talking about the supplemental plans, and I know there's so many terms for all of this, so bear with us, but the supplemental plan is Medigap, right? So it's a supplement, it supplements parts A, B, and D in original Medicare, so on the orange side of this chart here, there are actually like 10 different Medigap options that you can choose from. Most people usually pick, there's like two that like make a lot of sense for people. But the Medigap is the supplement that helps pay for some of the out-of-pocket costs associated with original Medicare. It's only available with original Medicare. If you have a Medicare Advantage plan, you cannot get a Medigap plan. But largely because the way Medicare Advantage or MA plans are structured, things are bundled. So there's a chance that you'll be exposed to less out-of-pocket costs. But there's still a lot of like gray area with all of that in terms of whether that is the case for you. But I think we do have to move on to our next topic, which is sort of like a big picture here, right? Now, we talked a lot about Medicare Advantage just now, and we're seeing, this trend over the past 10, 15 years that every year there's more and more people enrolling in Medicare Advantage plans. So, Tony, can you just give us a sense, like, why is this happening? Is it because the benefit is just so great, or like what do you think?
Sure. Just some numbers to start with. So currently, there are about 26 million beneficiaries who are enrolled in MA, Medicare Advantage, which is 42% of all Medicare beneficiaries. Back in 2015, that number was 17 million, not 31%. The Congressional Budget Office estimates that by 2030, over 50% of beneficiaries will have selected Medicare Advantage. What's behind this growth in Medicare plans, Medicare Advantage plans? I think the proof of the pudding is in the eating. People like the simplicity of MA. They like the one-stop shop concept. They like the possibility of low monthly premiums. They like the add-on goodies such as dental, hearing, vision, gym membership, all of which are heavily touted by the MA plans, which is sort of it's sort of ironic that original Medicare did not and does not include dental, vision, and hearing. These are the three things that we can be pretty sure are going to catch us up as we age, and yet Medicare doesn't cover these. Actually, on this particular subject, the early drafts of President Biden's Build Back Better legislation aims to fix this anomaly, but I think the jury is still out as to whether that's actually going to be in the final legislation.
Yeah, and what we know right now about the status of that, in the latest version, this particular piece of legislation now only includes the hearing benefit as something that would be added beginning in 2023 to Medicare Part B. But again, this is not law yet. This is just
so Nicole, it's only hearing if
yeah,
not dental or vision.
Right, because originally it was proposed for all three to be included, as part of this legislation, but after the negotiations, now it's sort of whittled down to just the hearing benefit. That could change, it could come back, but we unfortunately cannot give a definitive answer on that until the law is passed, and we have, something tangible to share. But I think, just overall, I think Congress and many advocates, NPAF included, and many of you who volunteer with us, advocate for these additional benefits that, like you said, really shouldn't be additional because they are very crucial to aging and, an important part of healthcare as a whole. So I think there is this push to get that to be included. It's just a matter of time. And I see Tony K has her hand up. Tony, do you want to unmute and ask your question or comment?
Yeah, thank you so much. I appreciate everything that you're sharing. It's a great clarification of the difference between the two. Working with cancer patients, there are lots of times that people have a rare diagnosis and they want to go to specialty centers to access clinical trials. And I just want to mention that from my understanding, standard care costs are covered in Medicare and Medicaid, the MA programs, but it's the ability to go to specialty centers that conduct research that really prevent a lot of patients from accessing clinical trials. And it's just something that I've run into a lot of patients that have Medicare Advantage and they're not able to get out of network.
Mm-hmm. Tony, I think that's I've come across that a lot as well, and it's I think one of the downsides of Medicare Advantage, if you were, is that it doesn't deal very well with highly specialist, highly technical conditions very well. Having said that, actually, one of the reasons behind the growth of Medicare Advantage is they now have Medicare Advantage plans that cater specifically for conditions such as diabetes and heart and lung problems. They're called SNPs, SNIPs, special needs plans. So there is some focus on trying to deal with this. But the point you made, I think, is very well made.
Great. So I think with that, let's see, going on, I think we spoke a lot about costs already, around sort of the standard costs with parts A and B, and where costs differ. So I guess Tony, where's the best place? Where would you point people to start comparing costs when it comes to choosing between Part D plans, right? Because one Part D plan may offer, $20 copay for your diabetes drug, whereas another Part D plan may offer it for $40 for the same drug, right? So that's what when we're talking about costs, it's the different plans have different copay amounts, right? All of this, and same for Medicare Advantage. So where is the best place to compare costs?
I mentioned this before, and I think absolutely the best place to go is the Medicare.gov website. It has a really user-friendly drug plan search tool, a really user-friendly Medigap plan search tool, amongst other things. Medicare Advantage plans, I think, is included on it. And it is surprisingly user-friendly, and it's almost fun to there's nothing fun about Medicare, but it's really cute website, and I really recommend people go to it. Even I can use it, so it must be simple. And it's very accurate. You have to, on the other hand, you have to be very specific about the in the drug plan search. You have to put in exactly the drugs that you need, the dosage, the frequency. You have to specify all sorts of things, but once you've done the initial load up, it's very, very good, and it will give you the 3 cheapest or least expensive plans in your area for the pharmacies you want to go to. It's a really excellent website. And if you would like further help, the SHIP offices in your local area, they will actually, using this tool, they will help you one-on-one do that plan search. And they basically take on the hard work for you and give you the answers. So I think there is really fantastic resources for this in these sort of otherwise overwhelming searches.
Great. Yeah, and I know they CMS actually did a revamp of that for a couple years ago. So the goal is for it to be as user-friendly as possible. And I know, when you go onto that site, and we'll include the link shortly, you put in your zip code, you put in some information about yourself so they can personalize it for you, and then it'll give you a lot of options, and you can do side-by-side comparisons too. So I cannot believe it, it's almost at the end of the hour, but we have a couple more topics to cover. I think the other thing that we didn't touch on around that is covered in our cost and financial help worksheet is around, if people have questions about, wow, like, this is going to cost me a lot of money, where can I get some financial help? Where would you direct people to? I know there's, in one case, depending on your income, right? If you could be duly eligible for Medicare and Medicaid, in which the two programs work together, so your costs end up being lower, right? So if you qualify for Medicaid, but that's definitely something a navigator would be able to help you with to determine whether you qualify or not. But then separate from that, I know there are these Medicare savings programs. So can you tell us a little bit about that and just how to ask for it?
Yeah, I mean, they are, the details of these can be found on medicare.gov. There are 4 different Medicare savings programs. The commonality of them is that they are the eligibility for them is basically income and asset related. And depending where you fall on that scale will depend on whether you qualify some of these, but many folks do, and they're very valuable.
Great. Yeah, and this is some of this is outlined on our NPAF worksheet. But again, navigators can definitely walk through and determine what you may be eligible for. Mm-hmm. Okay, there's a current events question that we wanted to cover today, which might be a great place to end in addition to sharing the resources. But so, we talked a lot about costs and sort of the structure, right, of the different options. And generally, every year, premiums and different components of costs may go up. So I know in general, this is largely due to the fact that just healthcare costs in the United States are increasing, largely due to new technology, new innovation. It's expensive. Certain medications, certain procedures are just, expensive. That's just sort of an overarching thing, not specific to Medicare, but just in general, right? So a couple of weeks ago, every year, CMS puts out, like, here are the rates or the premiums for Part B and Part D. And, they do the same with Medicare Advantage as well in terms of averages. But just a couple weeks ago, they released the numbers for Part B. So now people who are on Medicare can expect in 2022 to pay $170 for the monthly premiums. Whereas last year in 2021, well, this year, it was $148 a month. So it's a pretty significant jump, a little over $20 a month for Part B premiums. And the annual deductible also went up about $30. And then, there was also, an additional bump in Part D, as in dog, deductibles, and sort of, I don't want to get into Part D right now, just because that's a completely separate conversation that warrants a lot of time, because Part D, the structure is probably the most confusing part of Medicare, in my opinion. But the thresholds and like the different, financial, like the numbers are kind of shifting up, and they have been for years, right? So can you tell us a little bit, why is this happening? What's driving the premium cost specifically? Because I know CMS just, came out with some reasons for that.
I think it's it's interesting. I don't really need to tell you my opinion as to why it's happening. I'll tell you what CMS themselves are saying, and they're saying it very publicly. They're saying that there's 2 of the main reasons are, number one, rising costs and utilization of healthcare, And in particular, right now, because of the cost of COVID and the care involved in that. And a second factor, which is a very specific one, is that they're putting in an additional contingency reserve due to the potential use of an Alzheimer's treatment that the FDA has just approved for a drug called Aduhelm. Now, in fact, Medicare itself has not yet made a decision whether to approve that on its list. That's still under review, and I think it'll be sometime in the spring when they make that decision. But it's pretty unusual for Medicare to be influenced by just one drug and one treatment. But as we all know, there are so many sufferers with Alzheimer's that it's perhaps understandable why it's so significant.
Right. Certainly the market for that, but yeah, I think, and to your point about, not just one drug, I think that's sort of, on the same trend with, a lot of more, specialty medications coming to market. If they are going to be used, for seniors, Medicare sees that as like, okay, this is a cost that we need to anticipate, which ultimately, that's what kind of changes premiums, because if the program has to pay more for the treatment of things, then, that's the reason why they would raise premiums year to year. But
one particular good piece of news is that on this particular subject of NPAF actually has a seat at this table through its participation at ISEA, which stands for the Institute for Clinical and Economic Review. And this is a drug and treatment pricing review organization. And ISEA actually voted unanimously at its July meeting not to support this particular drug at the moment, because it wasn't justified with all the evidence as to the drug's effectiveness, its potential impact on Medicare's budget, which was proven to be right, now that Medicare are citing this drug as one of the reasons for increasing premiums. And all of that has a spin-off on health equity as well. So a very multi-pronged subject, actually. And,
absolutely.
Nicole, you might want to say a word about NPAF and ISEA and its involvement in it?
Yeah, I think just, I can just briefly share the Institute for Clinical and Economic Review. It's this organization that's reviewing a number of drugs and drug classes throughout the year. And NPAF has several representatives who, provide the patient perspective in terms of what is valuable for people in their everyday lives. And, what Tony is talking about regarding this one drug is something that happens, across a bunch of different drugs throughout the year. But we're, glad to be able to provide perspectives on this, because it's certainly has real financial impact for people and plans, as sort of these things trickle down. But I think with that, I cannot believe it's already 5 o'clock. So I'm going to close us out on a resource slide. So if we can go a couple slides over to this is where we want to direct you all. We covered a lot of information today. So again, if you have, I know I did see some specific questions raised in the chat. I wish I could answer them, but I actually am not the best person to answer some of those questions. But counselors like Tony in your state, as well as, trained one-on-one navigators, are the best people to go to with those questions, because they can really look at your entire picture and help you decide, what options are available to you. So the state health insurance program, Medicare counselors, that's the first bullet there. shiphelp.org is where you go and you put in your zip code. and they'll connect you to trained one-on-one Medicare counselors. You can also call that the 877 number for help via phone. The other resource mentioned today was the Medicare and You Handbook. That was that 150-page packet that you receive in the mail when you're a few months from turning 65. A lot of resources in there, but I understand it's a lot to go through. So use that as a reference. We can also include the link to that as well because it's available online. And then Tony mentions the Plan Finder tool on Medicare.gov. This is where you compare costs between your Part D plans, between your Medicare Advantage plans, and also like original Medicare, like it'll have the premiums for both on there. So that's Medicare.gov/plan-compare. And then finally, on the next slide, actually, I just wanted to highlight again the 2 NPAF resources that we have on our website. I put the link in the chat earlier. We'll have it in our follow-up email. One is like an 8-page step-by-step guide that talks about all of the elements we discussed today and kind of walks you through the steps. And then we have a new cost and financial help worksheet. It's more of a cheat sheet that gives you some links to directly look at this on Medicare's website, but just breaks down the costs for if you choose a Medicare plan, original or Advantage. And then on the second page, it'll have all of the financial help options, those Medicare savings plans. And again, the only thing that's not on here is like the supplemental Medigap options, because those are all on Medicare's website. But we do mention, that is an option that you can add on. And I think with that, just want to also plug, if you have or know someone who has been diagnosed with a condition, chronic condition, Patient Advocate Foundation is, of course, our sister organization. They are an incredible resource. The navigators also act as one-on-one counselors that can help you make an informed decision. So some of you may have found out about this webinar through Patient Advocate Foundation. So we're glad to have you. And if you've never heard of PIF before, please check out the website patientadvocate.org. You can fill out an online form to request assistance or call that 1-800 number Monday through Friday between 8:30 and 5 p.m. And hopefully between all of these resources, you will find a real person to talk to get your questions answered, because we all need that hand holding sometimes. And then you learn after doing this once, then you'll become the expert like Tony, and can help other people as well. So with that, just wanted to thank you for listening to our chat, and thank you, Tony, for doing this with me. And Melissa, you can close us out and take us away.
Sure. Thank you so much, Nicole and Tony, and to everyone here who put in your questions into the chat. I know we didn't get to answer many of them, but we will be sending a follow-up email where we will try to address some of your questions in that email. But there were 2 themes, and I think for those who are still here, thank you, that I kind of want to touch on before I close this out. One specifically around pre-existing conditions in Medicare, and another around disability. And Tony, I think I'm going to try to combine some of these questions all together. For people who are new to Medicare, signing up for the first time and maybe meeting with a counselor for the first time, what are some things that they should have ready for that first meeting? Like, what are some tips that you would provide, and would they be asked about pre-existing conditions?
They wouldn't be asked about them at a counselling session unless they wanted to discuss them. And I think in the initial counselling session, it's almost premature. As to what people should prepare in advance of I think you'll get out of a counselling session, a one-on-one session, as much as If you go into it without having done any homework at all, you're going to be frustrated. But if you've made a bit of an effort to understand the broad choices, some of which we've been talking about today, you'll get a lot more out of that counseling session. So that I think would be my recommendation. And also with these counseling sessions, on the one-on-ones, you know, it's not just that. You can have repetitive, well, not repetitive, you can go back for a follow-up session. One thing I would remind people is it's best to try and avoid the open enrollment period, because the counselors are very busy and they're rather limited as to how much time they can give you. But you're going to get a good hour, and then they'll do a drug plan search for you afterwards, or a Medigap plan search for you. But you'll get out of it what you put into it.
I think that's a really great tip for people here to, you know, to make sure that, you know, to do your homework. And I'm glad we were able to provide some information, some resources here for people who are new to Medicare or learning about Medicare Advantage for the first time. Again, I just want to thank everyone for putting in questions, and we will try to respond to as many of them as we can in our follow-up emails, with the disclaimer that Nicole had mentioned earlier, that we can't really speak to individual circumstances. But we really appreciate everyone being here. Just to close this out more formally, I just want to note that this is our Medicare Week of Action, and many of you here may have not even known, but you participated on our Thursday day of action by joining this fireside chat. And we ask that for tomorrow, you share our Medicare plan guide, the link that Nicole dropped into the chat earlier, with 3 seniors, you know, to help them understand their options and potentially save money. We really think this is a resource that can really help meet seniors where they are, help address a lot of the questions that they may have related to signing up for Medicare. So please, if you yourself can benefit from it, or if you know someone, we ask that you share it. And with that, we, you know, Nicole dropped the link to our resources, but more specifically, if you are interested in taking part in the Get Covered campaign and really want to take on some other actions, we ask that you go to our website, visit npaf.org/resources, click on Toolkit, and you can download our toolkit, which includes links to resources, much of which were shared earlier today. And it also includes a list of groups and organizations that you can reach out to, as well as some sample social media posts and graphics, and a sample email template that you can use that will help make sharing our plan guides easier. And some dates to remember, we noted that December 7th is the last day for Medicare open enrollment. December 15th is the last day to enroll in a marketplace plan for coverage to start on January 1st. We spoke a lot about Medicare today, but also just wanted to note some of the ISEA open enrollment is taking place right now as well, and that ends on January 15th. And we have another week of action at the start of the year, January 3rd through 7th. And so we invite you all to participate in that week, and we will be sending out more information about that soon. So please look out for that in your emails. And as I mentioned, we do have an email that will go out that will include a lot of this follow-up information, hopefully some answers to your questions. We ask that you please complete the survey at the end of this meeting. We always want to know, what is it that we can do to improve? What are some things that you liked about this? This is the first time we did a fireside chat, and we're so thrilled that there are lots of questions from you all, but please let us know how we did and how you found out about it. And if you have other questions, you're welcome to contact the NPAF staff here. I just want to take this time here at the end to thank you, Tony, for spending this now more than an hour with us. You are such a wonderful resource and advocate for NPAF. We thank you so much for just spending this time and sharing your knowledge about Medicare. So with that, thank you all so much for participating today, and we look forward to connecting with you in the future. Take care.
Bye, everyone.